Let's get started. This is extremely dangerous and should never be attempted. This experiment could result in blood clots, cardiovascular failure, permanent disability, or death. This content is purely educational. Understanding why your body demands you stand. Standing upright is not just a human characteristic, it's a biological imperative that your entire physiology depends upon. When you stand, you engage approximately 200 muscles simultaneously in a complex orchestration that most people never consider. Your cardiovascular system must pump blood against the constant pull of gravity, with your heart rate increasing by 10-15 beats per minute and blood pressure adjusting automatically. Your leg muscles, particularly your calves, function as a second heart, contracting rhythmically to squeeze blood back up toward your chest through a network of one-way valves. Your skeletal system relies on the mechanical stress of standing to maintain bone density through Wolff's Law, the principle that bone adapts to the loads placed upon it. Every step you take sends signals to bone-forming cells called osteoblasts, telling them to keep your skeleton strong. Meanwhile, your vestibular system in your inner ear coordinates with visual inputs and proprioceptors throughout your body to maintain balance through thousands of micro-adjustments per minute. Metabolically, standing activates large muscle groups that produce crucial enzymes like lipoprotein lipase, which helps break down fats and sugars in your bloodstream. Your lymphatic system, which has no pump like your heart, depends entirely on muscle contractions to circulate infection-fighting white blood cells throughout your body. Evolution spent millions of years perfecting this upright posture, and your body expects to use it regularly. When you eliminate standing entirely for 45 days, you're essentially telling your body that gravity has disappeared, and the consequences begin within minutes. Within the first few hours of refusing to stand, your body initiates a massive physiological reorganization that feels deceptively comfortable at first. The most dramatic change occurs in your circulatory system as approximately 1.52 liters of fluid that normally pools in your legs due to gravity suddenly redistributes towards your chest and head. This creates an immediate sensation of facial puffiness and possible sinus congestion as intracranial pressure rises slightly. Your brain interprets this fluid shift as a signal that your body has too much total blood volume. Your heart stretches slightly from the increased return, triggering the release of atrial natriuretic peptide, a hormone that commands your kidneys to dump fluid rapidly. You'll experience frequent, urgent urination as your body attempts to lower blood volume to match this new horizontal reality. Meanwhile, your leg muscles completely cease the constant microcontractions that occur during standing, and your hip flexors remain in a shortened position. Your brain's vestibular system, which constantly monitors your position in space, begins receiving confusing signals. You're conscious and alert, but you're not upright, a situation your nervous system finds increasingly abnormal as hours pass. By hour 6, you're experiencing significant discomfort as pressure builds on your tailbone, shoulder blades, or hips, and your legs feel restless from akathisia, your nervous system's craving for movement. By the end of day 1, your circulatory system shows clear signs of distress. The fluid purge has reduced your plasma volume by approximately 10%, making your blood thicker and harder for your heart to pump effectively. Blood flow to your legs has decreased by 15-20% compared to normal, as your dormant calf muscles no longer assist circulation. Your spine begins a painful elongation process as intervertebral discs absorb fluid without gravitational compression, potentially adding up to 2 inches to your height. While this sounds beneficial, the stretching of surrounding nerves and ligaments causes intense back elongation pain that many describe as a deep, constant ache. Sleep becomes severely disrupted as your circadian rhythm fractures. Without the energy expenditure of standing and moving, adenosine levels, the chemical that makes you sleepy, don't build sufficiently, leading to fragmented rest and daytime drowsiness. Psychologically, you're becoming irritable and obsessed with the simple act of standing that you're denying yourself. Most alarmingly, your metabolism crashes within 24 hours. Studies have found that insulin sensitivity drops significantly after just 1 day of immobility, as your inactive muscles stop absorbing glucose efficiently from your bloodstream. You're effectively inducing a temporary diabetic-like state, where sugar lingers in your blood, causing systemic inflammation even without dietary changes. Congratulations! If you somehow made it to day 5 without standing, your body has officially entered full rebellion mode. But here's what's actually happening inside. You're losing approximately 1-3% of muscle strength per day as your body perceives your anti-gravity muscles as expensive, unnecessary calorie. Consumers. Your quadriceps, hamstrings, and calves are visibly shrinking as you enter negative nitrogen balance, literally urinating out your muscle proteins. The most lethal risk during this phase develops silently in your leg veins. Without the skeletal muscle pump action of your calves, blood flow becomes stagnant, creating perfect conditions for deep vein thrombosis. Combined with dehydration from the initial fluid purge, blood clots can form in your deep leg veins. If a piece breaks off and travels to your lungs, causing a pulmonary embolism, this experiment becomes fatal within minutes. Your digestive system has ground to a halt without gravity's assistance, and the abdominal muscle contractions of normal movement. Severe constipation causes bloating and abdominal pain that compounds the ache in your lengthening spine. Your brain, deprived of the varied sensory input and spatial data it craves, may begin experiencing mild hallucinations or severely distorted time perception. This is where the experiment becomes dangerous, as your body shifts from adjusting to actively dismantling systems it no longer considers necessary for survival. Entering the danger zone at week 2, the damage moves beyond muscles to your skeletal system. Because your bones aren't bearing weight, your body stops repairing bone tissue and begins reabsorbing it aggressively. Calcium leaches from your bones into your bloodstream at rates 10 times faster than normal, particularly from weight-bearing bones in your hips, spine, and legs. This creates a dangerous dual problem. Your bones become porous and brittle while excess calcium floods your kidneys, dramatically increasing kidney stone risk. You've now lost 20–30% of your leg muscle mass, making your legs appear visibly wasted and stick-like. Your skin, lacking circulation stimulation and subjected to constant pressure, develops decubitus ulcers over your tailbone, heels, and shoulder blades, painful wounds that can become infected and expose underlying tissue. Your cardiovascular fitness has declined catastrophically. Your maximum heart rate capacity has decreased by 25%, and your VO max, measuring how efficiently your body uses oxygen, has plummeted equivalently to aging your cardiovascular system by several decades. Blood clots remain an ongoing threat as stagnant blood moves sluggishly through weakened, dilated veins. Socially and psychologically, isolation and lack of environmental stimulation trigger severe depression and cognitive decline. Studies show physical activity directly links to neurogenesis, and without it, your processing speed and memory recall slow dramatically. You're becoming physically frail and mentally foggy simultaneously. At the 1-month mark, structural changes in your heart become profound and potentially permanent. Your left ventricle, the chamber responsible for pumping oxygenated blood throughout your body, has atrophied significantly. Its volume has decreased and walls have thinned because it hasn't needed to work against gravity for weeks. Your immune system has weakened considerably due to chronic stress hormone elevation and lack of lymphatic circulation. You're highly susceptible to respiratory infections, particularly hypostatic pneumonia, as fluids pool in your lungs and shallow breathing fails to clear them effectively. Your tendons and ligaments have begun stiffening and shortening into contractures. Even if you wanted to straighten your legs, you might be physically unable without tearing tissue. Hormonal chaos affects every system. Testosterone levels have plummeted, growth hormone secretion has altered, and cortisol remains chronically elevated. This disruption affects mood, healing ability, and muscle maintenance. Your bone density has decreased by 1–2%, equivalent to several years of normal age-related loss compressed into weeks. By day 45, you've reached a state of severe physical deconditioning comparable to patients in intensive care units or astronauts returning from long-duration space missions. You've lost 40–50% of your leg muscle strength, and your legs likely cannot support your body weight. Your bone density in weight-bearing areas has decreased by 2–3%, putting you at risk for spontaneous fractures. Your blood volume has dropped by 15–20% from your starting point, and your heart has shrunk significantly. You've successfully adapted to being a horizontal organism, but you're completely maladapted to the vertical world. Multiple pressure ulcers may have developed into deep, infected wounds. Your feet might be locked in a pointed position due to tendon contractures. This level of deconditioning represents the extreme endpoint where attempting to stand becomes not just difficult, but potentially life-threatening due to cardiovascular collapse and orthostatic shock. When you finally attempt to stand on day 46, gravity hits like a sledgehammer. Your shrunken heart and reduced blood volume cannot maintain blood pressure against gravity's pull. Blood pools instantly in your legs as your weakened blood vessels lack the tone to constrict properly. Your brain becomes starved of oxygen, causing immediate orthostatic intolerance, vision tunneling, hearing muffling, and near-instant fainting. Recovery requires months of intensive rehabilitation. Medical literature suggests needing 2-3 days of physical therapy for every day of complete bed rest, meaning 3-5 months to return to baseline function. Muscle mass returns relatively quickly with proper exercise, achieving 60-70% recovery within 3 months. However, bone density recovery takes 6 months or longer, and some trabecular bone architecture changes may be permanent. Cardiovascular fitness improves faster than expected, blood volume normalizes within 2 weeks, and heart strength returns substantially within 2 months, though you may never fully regain pre-experiment capacity. Psychological recovery often proves most challenging, involving movement anxiety, fall fears, and possible post-traumatic stress requiring professional intervention. Real-world medical context. This scenario mirrors actual medical conditions. NASA conducts controlled bed rest studies where volunteers lie horizontally for up to 60 days to simulate microgravity effects, but with constant medical monitoring and specialized interventions. ICU patients experience ICU-acquired weakness from prolonged immobilization, requiring extensive rehabilitation. Astronauts on the International Space Station exercise 2+ hours daily specifically to combat these exact physiological changes, yet still need weeks of readjustment upon returning to Earth. Spinal cord injury patients who lose standing ability face identical risks: DVT, pressure ulcers, osteoporosis, and metabolic dysfunction, managed only through intensive medical care and assistive technologies. This experiment essentially replicates the worst-case hospital scenario without any medical support systems. Conclusion: refusing to stand for 45 days systematically dismantles your body from the cellular level upward. You lose muscle mass, dissolve bone density, shrink your heart, risk fatal blood clots, and fundamentally alter your metabolism. Evolution designed humans as upright, mobile organisms, and gravity isn't just a force holding you down, it's the resistance that keeps you strong. Do not attempt this experiment under any circumstances. The consequences are severe, potentially permanent, and completely unnecessary. If you're currently able to stand, appreciate this remarkable evolutionary gift. Stand up regularly, walk frequently, and remember that every upright moment is your body successfully defying physics to keep you healthy and functional.